Respect your fellow Oregonians by keeping up with the safety measures we know work. Limit your gatherings, physically distance, and wear a mask that covers both your nose and your mouth. As a state, we have done an incredible job this entire pandemic to make smart choices and fight the virus. Oregon has consistently had one of the lowest infection and mortality rates in the nation. If Oregon had as many deaths per capita as the rest of the country, roughly 3 times as many Oregonians would have died. That's more than 4,000 additional Oregonians that would have died from COVID-19 had Oregon been an average state in our response to the pandemic. We have not been. Your actions and your smart choices have saved lives. Thank you. Let's keep it up these last few miles. And as we do, know that every single day we make great progress in vaccinating Oregonians. Over the last week, we averaged getting 29 shots in arms each day. 23 counties are now offering vaccines to our latest eligible group, frontline workers, and on Monday, we'll open it up to frontline workers statewide. As we move into the days and weeks ahead, we will continue to deploy a vaccine strategy that's centered on prioritizing our most vulnerable and ensuring access to the vaccine for everyone. To do this, we need to move in a manner that is both fast and fair. Fast in the sense that we will keep up the efficient mass vaccination sites. The Oregon Convention Center is a great example. It's speedy and efficient. One day this week, they administered over 8,000 vaccinations, which we understand was one of the highest numbers of vaccines administered at a single site in the country. But we know that efficient and fast doesn't always reach everyone. That's why we are simultaneously engaging in intentional and thoughtful outreach to vulnerable populations and organizing smaller targeted vaccine sites. Take, for example, Morrow County, where just over 1,000 people were vaccinated over 4 days, and 1/4 of them identified as migrant seasonal farm workers. In the city of Boring, an agricultural nursery teamed up with their health insurance company and the local Costco pharmacy to vaccinate 500 of their employees. These efforts may take more time and planning to coordinate, but they are also very important. We need all of these avenues to reach every single Oregonian with a vaccine. Pharmacies, community clinics, pop-up events, and large-scale sites. We also need to make sure that access to the vaccine is fair. Making a group eligible isn't enough. Our actions need to support giving people the information they need and making sure vaccines are accessible to them. That's why today I'm announcing that the household family members of frontline workers will be eligible for a vaccine too. If you're a frontline worker as defined by the CDC, when you make an appointment for a vaccine for yourself, make them for your entire family, adults, obviously. If you're attending a community vaccine event, bring your family members with you. We know it's not easy for everyone to find the time and the transportation to get to a vaccination appointment. If you're a frontline worker making the effort, bring your family members and do it all together. Also, effective immediately, we're expanding our criteria of underlying health conditions to meet the CDC's extended list. Director Allen will share more. Finally, I'm asking coordinated care organizations and commercial health insurance providers to reach out to their members with underlying health conditions to share information about the importance of vaccinations and how to get connected to a vaccine. We appreciate their continued partnership. I'll end this morning with reminding everyone over the age of 16 to sign up at getvaccinatedoregon.gov. Not only can you receive notifications for how to access a vaccine, but you can also get vital information. And with that, I'll turn it over to Director Allen.
Thank you, Governor Brown. Good morning. I'm Patrick Allen, Director of the Oregon Health Authority, and today I want to update you on our vaccination projections in light of the manufacturing interruptions for the Johnson & Johnson vaccine that the federal government announced earlier this week. In addition, I'll give you the latest figures on vaccinations among older adults. I'm joined by Dr. Dean Seidlinger, our state health officer, and he'll give some troubling news about the rise of COVID-19 cases and what our model tells us we can expect in the weeks ahead. Here are the three main points I want every Oregonian to know about the progress our state's COVID-19 vaccination effort is making. First, Oregon will not delay our vaccine eligibility timelines despite the disruption in Johnson & Johnson doses. On April 5th, all frontline workers, younger people with underlying health conditions, and people over 50 who live in multi-generational homes will still be eligible to get vaccinated. And no later than May 1st, we still plan to open vaccine eligibility to everyone 16 and older. We still intend to give counties the option to vaccinate everyone as early as April 26th if they show they will have appointments available and have made strong efforts to reach vulnerable Oregonians with vaccine. However, we may need to temper our hopes of having enough doses to vaccinate all Oregonians over 16 by late May and bump that expectation back a couple of weeks. Second, Oregon continues to pass other states in the percentage of seniors who've been immunized, but as we discussed last week, demand for the vaccines has plateaued among older adults. And in some counties, more seniors have waited to get immunized than have chosen to get vaccinated. This flatlining demand should be a cause for concern for all of us. And third, at the state level, we're taking steps to broaden eligibility and make sure no one is left behind. In turn, we want to encourage every Oregonian to do his or her part and get vaccinated when you become eligible. Now let's look at the numbers. Let's go to the first slide, please. As of today, 1,216,455 Oregonians have received at least one vaccination. Overall, 28% of Oregonians have received at least one shot. The national average is 29%. Oregon is averaging 30,302 doses administered each day. Oregon's completed full two-dose vaccinations or single-dose Johnson & Johnson vaccinations for 679,035 people. Overall, 17% of Oregonians have been fully vaccinated, which is above the national average of 16%. Next slide, please. Now let's look at where we stand in vaccinating seniors. As of yesterday, 70% of all Oregon seniors have been vaccinated. That's more than 530,000 people 65 and older. In national rankings, Oregon is now 33rd in the nation in the percentage of older adults who've been vaccinated. By age group, that includes 72% of people 80 and above, 73% of people between 75 and 80, 72% of people 70 to 74, and 63% of people 65 to 69 years old. Next slide, please. But as this line graph shows, the pace of vaccinations among seniors has slowed. Throughout March, we were on track to vaccinate more than 3 in 4 seniors by early April. Then senior vaccinations slowed, not because older adults couldn't find appointments, not because Oregon vaccination sites couldn't handle demand, and not because other people with underlying health conditions or other eligible groups crowded them out. It's because demand for vaccines is softening among some seniors who have chosen to wait for a vaccine, especially in less populous counties. As of Tuesday, fewer than 50% of older Oregonians in 7 Oregon counties have been vaccinated. Those counties are Douglas, Gillum, Grant, Lake, Malheur, Morrow, and Umatilla. The rate of growth in these counties has slackened. Over the past 7 days, those counties have seen vaccinations increase at a rate of 2% or less, half the 4.75% rate of change statewide. In contrast, there were at least 8 counties that exceeded the statewide average where more than 7 in 10 seniors have been vaccinated. Those counties were Benton, Deschutes, Hood River, Lane, Lincoln, Multnomah, Polk, and Tillamook. We did have a coding issue that affected the way data were ascribed to Baker and Washington counties, which we're resolving. Those counties may also be at or above the state average. Older adults are the people who are most vulnerable to the virus. We expect our senior vaccination rates will continue to grow. We'll continue to support county efforts to vaccinate seniors and focus our outreach on people 65 and older who have yet to get vaccinated in communities where we know we can build more vaccine confidence. However, I want to encourage every older adult who's waited to get vaccinated to make an appointment today. More than 1 million Oregonians, half of whom are seniors, have been vaccinated so far. We know the vaccines are very safe. We know many people are worried about the side effects, but the COVID-19 case mortality rate among people 80 and older is 20%, 1 in 5. The serious risk the virus poses to older adults far outweighs the temporary discomfort and disruption you might experience from getting a vaccine. And vaccines give older adults the freedom to see friends and family, attend in-person worship services, go out for a meal, or make other choices about your life with less burden and worry. If you have questions, talk to your healthcare provider or go to covidvaccine.oregon.gov for more information about vaccine safety and effectiveness. Let's go to the next slide. Despite the leveling off we've seen among older adults, we remain on track to have vaccinated 7 in 10 Oregon adults by the end of May. Now let's look at our allocation forecast and see what the disruption in Johnson & Johnson doses will mean for Oregonians. Next slide. Here's an updated projection of our vaccine supply through early June. As you can see, we've pushed back the time frame when we expect we'd have enough doses to vaccinate all Oregonians who are 16 and older. The primary difference in this updated projection is the supply of Johnson & Johnson vaccine. Previously, we expected we would receive approximately 100,000 doses per week in April. Based on what was reported this week, there is a potential we will not receive any additional Johnson & Johnson doses until the first week in May. In other words, if that level of Johnson & Johnson supply disruption happens, it would equate to somewhere between 200,000 and 300,000 fewer prime doses than we previously expected. That shortfall results in about an 8 or 9 day setback in the time frame when cumulative doses in Oregon would exceed the number of people who are eligible. We're following up with CDC to get additional information about the Johnson & Johnson supply. This change in supply does not change the fact that the Johnson & Johnson vaccine is safe. The quality control checks that are in place caught the issue prior to shipping. For the week of April 5th, we're expecting an increase in prime doses, which includes a 1-week surge of 61,400 Johnson & Johnson vaccines. In addition, we're expecting an additional 60,000 Johnson & Johnson doses being sent to pharmacies through the federal retail pharmacy program. That total surge across all 3 vaccines raises our weekly total to over 275,000 prime doses next week. However, we expect that total to drop back down to around 150,000 prime doses the following week and stay at that level until May. The week of May 3rd, we expect to see our prime doses rebound to over 230,000 if Johnson & Johnson comes back online at forecast amounts. Once again, I want to emphasize, our vaccination progress depends on 3 factors: supply, demand, and our capacity to vaccinate people. While we've seen unexpected ups and downs in the first 2 factors, our capacity continues to increase. Over the past week, our daily average of doses administered has increased more than 3,000 doses per day to more than 30,000 doses. We've also seen days in the past week in which Oregon vaccinators administered as many as 40,000 doses. As Governor Brown mentioned, the All for Oregon Clinic at the Oregon Convention Center has vaccinated more than 8,000 in one day. According to FEMA, the OCC has exceeded some of the largest FEMA mass vaccination sites across the country, and it's amongst the highest performing sites in the nation. But this temporary Johnson & Johnson supply disruption isn't keeping us from looking for opportunities to make more people eligible sooner, and it won't stop us from working to close disparities in vaccination rates, especially amongst our hardest hit communities. As Governor Brown announced, we're expanding the types of underlying conditions that qualify for a vaccine effective today to match the updated list from the CDC. We're also expanding eligibility to family members of frontline workers. Next slide, please. This slide shows the underlying conditions that now qualify for a vaccine: cancer, chronic kidney disease, chronic lung diseases, including COPD, asthma, interstitial lung disease, cystic fibrosis, pulmonary hypertension, dementia or other neurological conditions, both type 1 and type 2 diabetes, Down syndrome, heart conditions, HIV infection, liver disease, overweight and obesity, pregnancy, sickle cell disease or thalassemia, smoking, current or former, solid organ or blood stem cell transplant, stroke or other cerebrovascular disease, and substance use disorder. Expanding eligibility to families of frontline workers and people with a wider range of underlying conditions is important for two reasons. These groups are at greater risk than the general population. We're aligning our list of qualifying underlying conditions with the CDC's expanded list, and that captures a broader range of health conditions that could increase a person's chances of experiencing a severe case of COVID-19 or worse. And most of the transmission we've seen in Oregon has been among family clusters. Short-circuiting family transmission protects loved ones of vulnerable frontline workers and in turn helps keep the virus from being passed into the workplace by frontline workers exposed at home. Prioritizing people in these categories will help reduce the racial and ethnic disparities we've seen in vaccination rates. Communities of color face an unfair and disproportionate burden of chronic disease due to systemic racism. They're also disproportionately represented among frontline workers. Expanding the circles of people eligible based on health condition or the relationship to someone in a frontline worker role also helps protect the communities who face the highest risk from the pandemic. Let's go to the next slide, please. Finally, when we talked about vaccinating 35,000 people a day and millions of Oregonians by early June, we can't lose sight of the fact that every person who gets vaccinated is another individual who's protected from the risks of COVID-19. And we need to find different ways to reach people no matter what barriers they face. Governor Brown told you about the Morrow County event to vaccinate migrant and seasonal farm workers. As a follow-up, OHA is partnering with the Federal Emergency Management Administration and Morrow and Malheur counties to hold a series of vaccine clinics in Boardman, Berrigan, and Heppner, April 5th to the 13th, and in Malheur, April 14th and 15th. The goal is to administer 2,000 J&J vaccines using a FEMA mobile unit. Lincoln County is sponsoring a clinic today and tomorrow in Newport, which is focused on reaching seafood, agricultural, fish processing, and seasonal and migrant workers. Their goal is to vaccinate 500 people in the next 2 days. The event will be ADA accessible and will have on-site interpretation as well. Finally, I want to share the story of Clackamas County paramedic Amy Jo Cook. On Wednesday, she was doing outreach to houseless people living in an encampment. While she was there, she offered COVID vaccines to the people living in the encampment. That day, she vaccinated 12 people who were at risk, but might not otherwise have been immunized. Her experience taught her that she'd need to take advantage of these kinds of moments to gain the best results. Next, she plans to drop in at a local shelter during lunch and shower times and visit the surrounding area to reach others who want the COVID-19 vaccine. This kind of outreach can take time, but it's vitally important to helping us reach community immunity. I want to thank all Oregon vaccinators who are working as hard as Amy Jo, the teams in Malheur, Morrow, and Lincoln counties, and at the big mass vaccination clinics like the Oregon Convention Center run by our health systems. With every vaccine you administer, you are saving lives and bringing us one step closer to ending the pandemic and returning to normal life. And for everyone who hasn't been immunized, I want to once again encourage you to get the facts, make a plan to get vaccinated, and go to covidvaccine.oregon.gov to find out when you're eligible, register for notifications, and get the latest information about vaccine events in your area. Now let me turn it over to Dr. Seidlinger.
Thank you, Director Allen. Before I discuss the most recent COVID-19 modeling, let me first provide a summary of where things stand with the pandemic in Oregon. As of today, OHA has reported 166,013 cases of COVID-19 in Oregon, and we continue to see a general trend of increasing daily cases, along with virus-related hospitalizations. Similarly, hospitalizations are significantly off their 2021 peak level. While there are 67% fewer virus-stricken patients in our hospitals since January 1st, hospital beds occupied by Oregonians with COVID-19 are increasing this week. According to the most recent report covering the week of March 22nd through March 28th, OHA reported 10 deaths, the lowest weekly total since last June. To date, there have been 2,385 COVID-related deaths in Oregon. My thoughts go out to everyone who has experienced a loss to COVID-19. Counties across the state are seeing reduced risk levels, opening more activities to Oregonians just as spring arrives. But with rising spread of disease, more counties may increase their risk levels in the coming weeks. More of our friends, family, colleagues, and neighbors are getting vaccinated every week. While vaccinations are still increasing, we all have the tools to protect ourselves and our loved ones, wearing masks, keeping our distance, and limiting our higher risk indoor gatherings. And these activities are not forever, just for now. Let me turn my attention to variants of concern. Since February 3rd, OHA has been reporting a cumulative count of each variant of concern on its dashboard. These counts have been based on information reported directly to public health by our laboratory partners. On March 16th, the Centers for Disease Control and Prevention reclassified the B1427 and B1429 variants as variants of concern. These variants have been circulating in Oregon since late 2020 and had not previously been reportable. OHA has reviewed historical data in the open source sequencing data platform GISAID and has identified more than 200 of these variants to date in Oregon. In order to provide a comprehensive picture of variant circulation in Oregon, OHA will begin updating its variant of concern counts using this GISAID data. This will allow for rapid reporting of historical data whenever the CDC definitions of variants of concern are updated, and the dashboard will be updated with this data today, and it will be updated weekly moving forward. Oregon will continue to ask all laboratory partners to report all variants of concern and variants of interest to public health immediately in order to inform our case investigation and contact tracing. Now let me move on to the most recent COVID-19 model, which I'll discuss in a little more detail later. But this shows an accelerated spread of the virus consistent with the pessimistic scenario outlined just 3 weeks ago. We are seeing lately an increase in daily cases and a corresponding uptick in COVID-19 hospitalization. For the month of March, hospitalizations have increased by 17%. Our rolling 7-day average has increased by 22% and is now at 392 cases. In our most recent weekly report, we reported 2,456 new daily cases of COVID-19, a 28% increase over the previous week, and our percent positive test climbed to 3.7%, still below the 5% where we are more concerned. These are indications that despite the progress we've made, the virus appears to be rebounding. At this point in the pandemic, we know this much. COVID-19 is a resilient enemy. But we also know that Oregonians have the tools to fight this virus. We did it last spring, this past summer, and winter. We will prevail here as well. And I thank you for continuing the fight. Remember, this is for now, while we offer vaccines to all adults and not forever. It's tempting as we move closer to the finish line to fall away from the public health interventions, but we must not let that happen. We all possess the tools to have the power to slow this virus by continuing to wear our masks, gather more safely, and keep our distance. And of course, getting vaccinated as soon as you're eligible and when it's your turn. Thank you for continuing to take these steps to protect yourselves, your families, and the loved ones around you. Let me add another note of caution. Just because we're vaccinated doesn't mean we can return to pre-pandemic life just yet. Until we see enough Oregonians vaccinated to stop the spread, we must continue with these protective measures. We cannot cede our momentum to this virus. Among the welcoming wave of the reopenings we are seeing in many communities is a return to in-person classroom instruction in schools across Oregon. Declines in daily cases and in positive testing for COVID-19 have allowed for greater access for our school-age students. In-person instruction is important for the well-being and mental health of our students. OHA works closely with the Oregon Department of Education to develop science-based protocols within the Ready School Safe Learners Guidance, including the use of face covering, class cohorts, and more recently, changes to the physical distancing requirements in line with data about effectiveness of these control measures in schools. OHA and ODE work together to prioritize vaccinations for educators and school staff following the governor's recommendations. Studies from around the world and experience throughout the country show schools are not a driver of COVID-19 transmission. Though with increased cases in the community, we will see more cases who may attend school. However, our case investigators suggest that peripheral activities are contributing to outbreaks, not being in the classroom. OHA has reported 386 school-associated cases between January and March of this year. Of that number, 218 had only one case on campus, and 168 outbreaks had 2 or more cases. But on closer examination, we show that of those outbreaks with 2 or more cases, transmission within the school has been identified in only 30 schools, meaning that of the schools identified with having cases of COVID-19 this year, only 7.8% were found to have transmission in school. More than half never extended past that initial case that we identified. Let me give you a couple of examples. We had a high school student athlete that developed mild symptoms without realizing they had the virus. The student continued to attend practice and participated in a travel game. Later, the student tested positive and several other teammates became symptomatic. The outbreak is now extended to the coaching staff and to other support at the school because several students play multiple sports. And we have 15 people who are sick associated with this outbreak. In another case, we've seen approximately 80 people, mostly students, who attended a social gathering where there were also 6 infectious people in attendance. This outbreak resulted in 35 cases from the immediate party and 30 cases that were infected secondarily. The local public health authority noted the efficiency of spread was most likely due to people not wearing their masks and gathering in close quarters indoors. When we're with the people, our friends, our family, and our loved ones, we tend to let our guard down. Another contributing activity cited in this outbreak was riding in cars, along with eating lunch and socializing in a vehicle. 53 of the student cases were spread across 4 high schools. But we know that with adherence to public health interventions and other guidelines within schools in Oregon, they can open and operate safely for students and staff in counties where risk levels allow. Spread of COVID-19 is rarely happening in classrooms or structured school activities, but rather in those activities that surround schools. Now, finally, let me turn to our COVID-19 forecast. The report shows a considerable increase of transmission through mid-March, with an estimated reproduction rate of 1.12, meaning that for every person infected with the virus, it's spreading to more than one additional person. If that level of transmission continues as is, we can expect to see new daily hospitalizations increase to 17 for that 2-week period from April 7th through the 20th. If the more contagious variants take off, or if we relax our vigilance and transmission increases by just 20% over the same period, daily hospitalizations will increase to 27. However, Oregonians can stay the course and do what they've done before, flatten the curve, and see our transmission drop. Then we'll see our hospitalizations decline to 11 new daily hospitalizations. We're all tired of COVID-19. We crave a return to seeing our friends and family more, traveling and getting back to the activities we love. As this latest model shows, we still have some work to do. We must remain vigilant, but experience has shown us that small setbacks can have huge consequences. We in Oregon have made tremendous progress in turning the tide of COVID-19. These actions we're asking you to take are for now and not forever. So let's not squander our hard-won progress. Thank you for the continued partnership in fighting this virus. And with that, I'll turn things back over to Governor Brown.
Thank you, Dr. Seidlinger. And with that, Charles, we're ready for questions.
Thank you, Governor. We'll get started with Pat Duras from KGW. Go ahead, Pat.
Thank you. Governor, I think a lot of people will be excited that family members are included with frontline workers. But I'm wondering if you folks have any advice on how people should go about getting those family members appointments. Probably a lot of frontline workers already have their own appointment. Thank you.
Thanks, Pat. I'm going to turn that over to Director Allen.
Yeah, thanks for the question. I think really it's going to just be a matter of using the same scheduling tools. I think frontline workers that have become eligible now tend to be in more rural communities where the crush of demand for appointments is a little bit less. And so I would suggest they go back to the same scheduling tools that they used. In the metro area where eligibility starts on Monday, Multiple appointments can be scheduled, and I would recommend that folks go ahead and do that, whether they're using the convention center, a local pharmacy, or other tools.
Okay, thank you.
Thank you, Pat. We'll go next to Lisa Balick with COIN. Go ahead, Lisa.
Yes, good morning. Question for Director Allen. States across the country, including Washington, are informing the public about the number of breakthrough cases, in other words, getting COVID after being fully vaccinated. I was told last week that OHA won't provide that information due to privacy, but without identifying information, will Oregon provide the number of breakthrough cases to keep the public aware that the vaccine is not 100% effective, and also to encourage people to get tested if they have symptoms after getting the vaccine?
Yeah, I think I'd actually, Lisa, like to pitch that question to Dr. Seidlinger.
Thank you, Lisa, and thank you, Director Allen. We continue to monitor cases that have developed in people who have been fully vaccinated and have been 2 weeks from their last dose. When we initially started getting breakthrough cases, we reported those initial 4 cases. But in order to protect privacy, we didn't want to do so in an ongoing way. But as more Oregonians have gotten vaccinated, we will work with our local public health authorities to consolidate the number of breakthrough cases and report that. What I can say is that to date, the number of breakthrough cases has been very limited, considering the approximately 700,000 Oregonians who are fully vaccinated. This would be in line with the data that Washington State reported earlier this week and that other communities are seeing. These vaccines are safe and effective. Even in people who develop disease after being fully vaccinated, they protect against the most serious impacts, and we are not seeing hospitalizations in these individuals. So we'll continue to work to collect that data and share it in the near future.
What is the actual number right now statewide?
Dr. Seidlinger, can you answer that question?
I don't have the number of breakthrough cases statewide in Oregon at this time. And again, we're compiling that data and we can get that back to you.
Thank you, Lisa. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
There we go. There we go. Hi. I wanted to find out this morning, the CDC announced that it was going to ask Moderna to increase the amount in vials by 50%. Have you guys heard that? And is that going to help at all with the amount of vaccine that's coming into the state?
Gary, I certainly read that in the news this morning, but I don't have any further details. Director Allen, do you have any more information?
No more concrete information. One of the things we're trying to find out is this, vaccinators have been getting more doses out of Moderna vials than the 10 that it's labeled for, much like Pfizer back at the beginning. And so we're trying to figure out, is this CDC asking Moderna to put more vaccine in vials, or is this reflecting the amount of doses that are available? If it's the first, that's a pretty big deal. If it's the second, it's less impactful.
My perception,
Gary,
Pat, is this the first, according to the New York Times today, that they're to put more vaccine into each vial. So, but we can come back on that. I do have one other follow-up, because you, Dr. Seidlinger said that we may see some counties going back up in risk level. In the past, sometimes when counties have been close, they've been given sort of a grace period because the overall numbers aren't too bad. What about counties in this coming week that are close to moving up on risk levels? Is there that sort of flexibility, or are you going to more likely move counties back up on risk level?
Thanks, Gary. Dr. Seidlinger, do you want to talk about our 2-week grace period, please?
Yes, thank you, Governor Brown. What we've done is adjust the risk level framework when we look at the county data each week. We have been giving a warning week where we present the data so counties, businesses, and residents in that county can see what the trend is in their county, and then movements are made on the data every other week. What we've done for those counties who recently moved down is in that movement week following when they move down, even if their cases have increased, they will be held steady in the risk level where they are. That will give that county 4 weeks to try and maintain the trend that brought them down into lower risk, and work with local public health work with messaging to residents about limiting higher risk activities, continuing to wear masks in settings where they're required, so that businesses aren't seeing fluctuation up and down in risk level. But certainly if counties are seeing increased cases, the data may show that next week some counties may qualify to move up in risk, and we'll wait and see what that data looks like on Monday. The trend this week was that 4 counties that recently moved down in risk have seen an uptick in cases, so they would be held harmless next week if that trend continues. But 4 additional counties showed that their case rates had increased enough that they would qualify for an additional risk. So we'll continue to monitor this data, work with Governor Brown's office, work with our local communities, and share this data and make decisions about limiting the spread of COVID-19 based on spread in the community.
So just to be clear, the grace period is only for the counties that are boomeranging back. If a county has been at a lower level for quite a long time and is now moving into a higher level, they would be put into the higher risk level?
The grace period that was put in place in the past month was for those counties that had just moved down. Other counties that have moved down in risk and have maintained that risk, but then later show an increase in cases, have moved up in risk level during this response. And we'll continue to monitor the data and make recommendations and decisions in conjunction with Governor Brown's office.
Thank you.
Thanks, Gary. We'll go next to Genevieve Riom with K2. Go ahead, Genevieve.
Hey there, thanks for taking our questions today. I have 2 questions. The first one, if cases and hospitalizations are increasing, why aren't we opening up vaccines to all Oregonians 16 and older?
Genevieve, that's a really good question. The goal of Oregon's vaccination strategy is to make sure that we are doing this fast, but that we're doing this fairly. And we're relying on the work of the Vaccine Advisory Committee to center equity. We know that communities of color have been disproportionately impacted by the pandemic. And this next tranche of openings includes frontline workers and vulnerable Oregonians between the ages of 45 and 64 that have underlying health conditions. This group is more diverse, and we want to make sure that these vulnerable Oregonians get access to the vaccinations and are prioritized in our vaccination strategy because they're more vulnerable to the disease.
Thank you, Governor Brown. The next question is for Director Pat Allen. Are you seeing an unfair distribution of vaccines state by state? Or are you worried about Oregon's distribution?
The distribution of vaccine is complicated. It's not at a federal level. It's not a straight per capita distribution. There are factors like distribution through the Veterans Administration, through the Indian Health Service, and through other channels. And so it's not something that we can sort of just run some calculations and figure out is it going the way that we think it should. That said, we're concerned about the number of doses that we're receiving, and the governor's office has asked some questions of CDC and the White House, and we're trying to get a better understanding of how those formulas work and how we have vaccine distributed to us. And if there's an issue, we'll want to pursue that.
Genevieve, I'll just add, please know, Oregonians should know that we will move heaven and earth to make sure that we are getting our fair share. If we are not, we have a great congressional delegation that goes to bat for Oregon every single minute of every single day. And we've got a great relationship with the Biden-Harris administration. So I'm sure we'll get this matter resolved quickly.
Thank you.
Thanks, Genevieve. We'll go next to Mike Cerullo with KEZI. Go ahead, Mike.
Hi, my question is actually for Governor Brown. It's about risk levels. Now, some community members and business owners are growing frustrated that they're changing and having to face the possibility of reopening and then closing or reducing capacity. Can we expect to see updates to this system as more vaccines roll out and things change?
Well, right now, what I would say is that the framework is absolutely necessary. The goal of the framework was to make sure that it was sustainable for our businesses and our communities while we reduce the spread of COVID-19. We still don't have community immunity yet throughout Oregon. So obviously it's a race against time, and we're working very, very hard to get more Oregonians vaccinated. And as Dr. Seidlinger said, we have variants present in communities around the state. So we're going to continue to use the metric system. We always welcome feedback from our local elected officials, and in fact was on the call yesterday with a county chair from a Southern Oregon county. We'll continue to take that input. We want to make sure that we keep people safe, that we reduce the transmission of the virus, and we get Oregonians vaccinated very fast and very fairly.
Thank you, Mike. We have time for just 2 more questions, so we'll go next to Amy Green with the Oregonian. Go ahead, Amy.
Yeah, hi, thank you. I have 2 questions. First one is the new cases of COVID have been going up 42% in the last 10 days. In the past week, it's a faster rate than cases have increased nationally. In the meantime, we have these restrictions that are allowing restaurants and gyms to operate at 50% capacity in many, many counties across the state, movie theaters to be open. Governor, my question to you is, are you thinking of tightening those restrictions, given what you said, that we need to hang on and hold tight and work hard because we're in the last few months of this pandemic? Maybe.
Look, as I said, I'm always open to feedback from our partners at the local level, and continue to rely on our health experts and medical professionals in terms of decision making. I feel very comfortable in terms of the metrics where they are right now. I'm obviously very concerned about the increased spread of the virus throughout Oregon. That's why we are working hard to get more Oregonians vaccinated, particularly our most vulnerable populations. And we're asking Oregonians, and I know it's really, really hard. We have been in this now for a year. I'm asking Oregonians to continue to rely on safety measures. For example, wearing masks that cover nose and mouth, making sure that you're physically distancing, watching that 6 feet, and washing your hands, and keeping your social gatherings small. Dr. Seidlinger, would you like to jump in on that one?
Thank you, Governor Brown. I think when we set up the county risk levels and announced them in November, we said we need a system that will give some projections to counties, to businesses and individuals about how we would treat the virus this summer or this winter, how we would live with it and how we would try and defeat it. That system helped contribute to lower peaks around the holidays and a quicker decline at the beginning of this year than many other states saw. Unfortunately, now with variants of concern arriving and with individuals going out more and some not wearing their mask as much, we can see that anecdotally and also in our data that mask use is going down, travel is going up. So we continue to monitor that information, and if cases do increase, that risk level does allow for reducing some of the activities that are allowed to help control that virus. So the same way we use that to lower the risk and increase activities that people could participate in, the reverse will be true as well as we get through this potential surge with cases and hospitalizations increasing as we get more vaccines into arms. But again, we all have the tools to help control this virus. Think about the actions you're taking, limit your social gatherings, particularly higher risk indoor social gatherings. Keep your mask on, covering your nose and your mouth, and keep your physical distance. Again, these activities are for now and not forever. We can get through this together.
Thank you. My second question.
And Ivy, just noting this will be our last question. Thanks.
Okay, cool. Director Allen, can you tell me what the numbers, now that there's a greater expansion of who's going to be eligible, can you tell me what the numbers are of people becoming eligible, like, by April 5th, how many will be eligible? It seems like we're getting pretty close to everyone already being able to be vaccinated.
Yeah, I can't give you a good number for April 5th, and the reason for that is we're at a place now where people are counted in multiple categories, and the chances of that just kind of increases every time. we add somebody. So think of someone who works at a grocery store who's got an underlying condition, who's over 65 or those kinds of things. But you're right, we're at a place where the proportion is getting relatively high, but we still want to maintain a focus on people who are more at risk of getting the disease and more at risk of serious outcomes if they do get sick. And that's really where we are right now, focused through the end of April.
Thank you.
Thank you, Amy. With that, I do want to say thank you to our interpreter teams who've just done an outstanding job helping us every week with both language and sign language interpretation. Really appreciate your efforts. And also want to give a shout out to our amazing vaccinators across the state. We wouldn't be where we are in terms of shots in arms without you. So keep up the great work. We are so grateful for your time and energy and your dedication. Let's get vaccinated. Let's make it happen. Thank you.